You may be aware that Sri Lanka is well known for its very high suicide rate. It's not something I'm sure any Sri Lankan is proud of. In fact, in 1996, Sri Lanka had the highest suicide rate in the world, with almost nearly 9,000 people committing suicide in that year. Now that's an average of 24 people committing suicide a day. Today, Sri Lanka is still amongst one of the highest in the world for suicide rates. However, the rate has dropped to approximately 11 people committing suicide every day. And I'm sure everyone would agree that's 11 too many. We have a panel who would like to share with you their thoughts and their expertise about mental health in Sri Lanka and how helplines such as CCC Line or Lifeline here in Australia will provide relief but also prevent suicide in those countries. And also we'd like to share some great initiatives here in Australia and how that perhaps links to Sri Lanka as well. And we also have a very, very personal story that we would like to share. So, ladies and gentlemen, joining me on the panel is none other than Kumar Sangakkara, Sri Lankan cricketer and CCC Line ambassador. Next to Kumar is Mary Parsons. She's the president of Lifeline International and also a board member of CCC Foundation. Next to Mary is Associate Professor Dr. Harry Minnis. He is the Director of Centre for International Mental Health, Melbourne School of Population Health, Melbourne University, and has an immense amount of experience working in Sri Lanka as well in that capacity. We have then Linnell Angus, who is the Indigenous and Priority Communities Program Leader from Beyondblue. Next to Linnell is Vivian Archdahl, who is the coordinator of Mind Matters, who do wonderful work with school students here in Victoria. How about a big hand for Vivian, yeah? Lastly but not least, we have Carmel Crawford, and thank you, Carmel, for coming today, who will share with you an experience of suicide, a close member of a family suiciding, which is quite tragic. So, ladies and gentlemen, once again, please welcome the panel. Kumar, I'm going to start with you first. Now, Sri Lanka is a country that has suffered tumultuous past, marked with war, a natural disaster. What do you see personally as the main contributors of mental health issues and suicide in your country?
I think I did a bit of research because, unlike the rest of the panel, I don't think I'm qualified to talk about this in depth. So I did a bit of research, and mental health and mental health issues, and then suicides. Mental health issues are on the rise in Sri Lanka, and that is mainly due to a 35-year conflict and also poor socio-economic conditions. Poverty, lack of nutrition, a lack of basic healthcare facilities, and also the 2004 tsunami. There's also a very urgent shortage of healthcare professionals. I think in Sri Lanka it's about one psychiatrist to about 500,000 people. But those psychiatrists are also more prevalent to house themselves in and around urban areas. There's also quite a lot of trained staff in mental health care, in the mental health care services. They're not trained or sensitive enough to identify and deal with people who are suffering with mental health issues. Suicides, of course, in Sri Lanka, we've had some of the highest suicide rates in the world. Suicide among women is on the increase. It's second only to China in the world. They happen, I think, due to a lot of reasons. In Sri Lanka, it's mainly due to relationship issues, love affairs gone wrong. There's poverty, parental pressure on marriage. There's fear of examinations and failure at examinations. There's inability to pay loans. I think we had a spate of suicides when there was a huge issue among farmers and the growing of tomatoes when that particular industry collapsed. And a lot of farmers committed suicide because they could not pay back their loans. And in recent years, we've also had a lot of women going to the Middle East to work, and that's also resulted in an increase in suicides. Also in Sri Lanka, you have very easy access to very lethal poisons, especially because they're not as regulated as they should be, and they're largely available to the rural farming communities. And because emergency services and lack of quality healthcare services, and also the lack of cheap antidotes, means that almost always self-poisoning is fatal. So there are quite a number of issues that do contribute, but I think, especially with mental health issues, it's compounded by the fact that in Sri Lanka it's always been taboo. We don't talk about mental health issues. If you have someone in your family who's suffering from mental health issues, they're usually hidden away because they think that it shames the family, it affects the marriage opportunities of other members of the family. So it is something that you're encouraged to forget. And even in our national health services, you find that mental health issues and services around them are underfunded and ignored.
Thanks, Kumar. And as the ambassador of CCC Line, why do you think a telephone counselling service like CCC Line is useful, in Sri Lanka as a result of mental health or suicide?
I think in Sri Lanka, the way we're brought up, most often anyone with mental health issues are judged. They're not encouraged to talk about it. And also, if you do talk about it, I think they're afraid of confidentiality issues, and of course, of their issues being made public, and they're again bringing more shame and then compounding the problems. Also, CCC Line, I think, and other counselling services, they don't judge, they listen, they try and help empower that particular person to deal with the problems themselves, and if they can't, they usually refer them to specialist care and other services available in that particular region. When people have mental health issues, they always, try to cope with that crisis. But when the problem becomes too much and their ability to cope breaks down, that's when they're most vulnerable and they're left frustrated. And if they do not have access to services like counseling, then problems can get worse. Of course, not everyone with mental health issues is suicidal, but at the same time, this allows a great deal of anonymity, but also confidentiality, and the ability to access trained mental health care professionals. And I think if we can make these services more available, the burden on a lot of people will be lessened, a lot of families will be lessened, and also in Sri Lanka, I think the most vulnerable section now identified with mental health issues are children. So actually, it's a lot to do with rebuilding a society in a post-conflict, post-tsunami country.
Thanks, Kumar. Mary, I'll come to you next. Mary, you were instrumental in putting Lifeline Hobart and CCC together, and resulting in CCC Line. You visited Sri Lanka. You've actually done some work with CCC Line in Colombo. Based on your experience internationally, how is Sri Lanka placed amongst other countries in the region in terms of number of people affected by mental health and suicide?
Listening to what Kumar said, I think that it reflects a lot of the issues that are around the Asia-Pacific region that I've seen. I remember going to Samoa, where they equally were not storing the paraquat, which is used to kill the weeds around the taro plants. And I remember them saying, had a flyer out saying, 2 teaspoons of paraquat will kill you. And I thought, if I was suicidal and I read that, I would have 3 teaspoons and I would make sure I was going to die. Because the difficulty with the weed killer is that it is just about irreversible unless it's reversed very, very quickly. And as Kumar said, it's not always able to do that. So people endure a slow, agonising death for about 3 weeks before they die. So I think that what I see in Sri Lanka and listening to what Kumar said is exactly right. That there's a lot of mental health issues that are not recognised. There is a stigma around mental health issues in some of the Asia Pacific countries. And of course that's been true in Australia. And I remember in my childhood and even beyond that, where mental health has a stigma and still does have a stigma. It's still a stigmatising issue for us in Australia to have a mental health issue, but it is more so in some of these Pacific Island and Asian countries. So I think that, Lifeline Australia gets over 500,000 genuine calls a year. If you look at our population in Australia, it's about the same size as that population of Sri Lanka, spread over a much broader region. So when you think about 500,000 calls that we get, and you think of the number of helplines that are in Australia, when you think of the number of mental health services that are available to people in Australia, freely and fairly easily accessible, not perfect, but better than in some of these countries, and we still need lots of helplines that provide an excellent service, then when you look at somewhere like Sri Lanka, which is struggling with some of the issues that Kumar talked about, then it's an ongoing issue for them, and I think CCC Line provides an excellent service there that fills a big gap.
Thanks, Mary. Mary, telephone counselors like Lifeline and CCC Line obviously, I think, undoubtedly offer immediate emotional support. However, is there any evidence to show that that having contacted a helpline, people feel more willing to get other professional help afterwards?
There's a lot of research being done around helplines and the efficacy of helplines, and that's been done internationally. And some of the research has shown that helplines provide an immediate anonymous first contact service. And when people contact a helpline and get a good response by well-trained volunteers or professionals, then they feel more empowered to actually go on and get further help. So with the encouragement of helplines, people then feel more empowered to go and get professional help, and that's been well validated by research.
Thanks, Mary. Mary, Harry, if I can go to you next. I know you've done very successful work in developing mental health services in the southern province, and now you've just got a new project in the northern and eastern provinces. What would you say are the main risks and vulnerabilities for development of mental health problems amongst different sections of the Sri Lankan population? Demographics, that is.
Well, I think Kumar summarised them very well. Somebody in the audience asked him what he was going to do after cricket. I think there's a role in mental health for you, Kumar. The understanding of what are the key issues, I think you presented very clearly. Long-running conflict actually damages the fabric of society. People lose trust on both sides. The kinds of things that are necessary to hold people's lives together are destroyed, sometimes literally, sometimes emotionally, sometimes in terms of the kinds of bonds and the trust that's necessary to even do basic things in life. There are some other issues, I think. The place of women is an issue in Sri Lanka. We've been seeing a lot in India recently about what's happening in terms of women. I think there are many families, particularly those who are under enormous economic stress in rural areas where there is still considerable poverty, where alcoholism is a big problem, domestic violence is a big problem. That leads to all kinds of problems, obviously, for women and for children and for families. So I think most of the issues are social issues. And it's the rebuilding of society that's going to be, that is the big challenge in this sort of post-conflict and post-tsunami period.
Harry, how do you think government, you've been working with the Ministry of Health before, or civic society and other key players, can ensure that mental health is protected, in particular with women and children, and that appropriate services are available for people with mental illness?
Well, the main issue is to recognise just how important mental health is. Without good mental health at an individual level, at a family and community level, very little else is possible. Whether it's economic activity, whether it's actually developing society in the way that it needs to be developed during this period. So I think the first thing is recognition. I think to its credit, the Sri Lankan government recognises the importance of mental health. And a great deal has actually already been done. We were talking about suicide. The drop in the suicide rate is pretty dramatic over a relatively short period. And that's largely a result of government action. And interestingly, it's not a result of work that's done by the Ministry of Health, but that's done by the Ministry of Agriculture. So actually doing things about safe storage, education and so on about pesticides. And I think that illustrates something else very important about mental health, that it needs to be a whole of government issue. Education is really important. Empowerment of women is absolutely critical, particularly where there are real problems. And I think the Sri Lankan government, if you compare like with like, that is, if you can compare countries with similar sorts of resources that Sri Lanka has, and with a similar kind of a troubled history, I think Sri Lanka is doing really incredibly well in attending to mental health issues. That doesn't mean more doesn't need to be done, a great deal more needs to be done. When we first started working in Sri Lanka after the tsunami, there were more Sri Lankan trained psychiatrists in Melbourne than there were in the whole of Sri Lanka. So, you know, the shortage of skilled people is absolutely critical, and it's even worse in areas like psychology and social work and so on.
All right. If I can ask a question of Lynelle from Beyondblue. Lynelle, you work very closely with the Indigenous and priority communities in Australia, addressing mental health concerns. Can you tell us more about the work and a little bit more about the priority communities?
Yes, sure, Jack. I'd like to begin by acknowledging the traditional owners of the land on which we're meeting tonight, and I'd like to pay my respects to elders past and present, and extend that respect to all elders across Australia. Beyondblue identified through the strategic directions 3 major population groups, clearly Aboriginal and Torres Strait Islander people, gay, lesbian, bi, trans and intersex people, and people from culturally and linguistically diverse backgrounds. This is a fairly new body of work that we've entered into, but we have done some work with culturally and linguistically diverse communities a couple of years ago through the Universal Stories of Healing from Depression. We worked with Karen speakers from Burma. We worked with Afghanistan refugees and Sudanese refugees to, I guess, develop a resource that made sense to the communities. And so we worked with I See, I Learn and the Australian Centre for Social Innovation and the three community groups who were in Melbourne to, I guess, work out what their explanation and also experience of depression and how that healing happens. And it was really interesting in that they were 3 very different experiences. So for the Sudanese people, how their experience was described was a very physical experience. So it was like a sickness. Whereas for the Karen speakers, it was a suffering, a deep suffering. And for the Afghanistan people, could relate to the word depression, and understood what that felt like and what that meant. And I guess we've been working with that same model with 2 Aboriginal communities, one up in remote Northern Territory and one in Mount Druitt as well, using a similar sort of process to develop what we are calling stories for keeping strong, to help people, I guess, recognise within their own cultural and social context, but also what that healing might look like as well.
That's actually fantastic work. I mean, these experiences, these initiatives you've gathered through Beyondblue work, are these transferable to communities, developing communities like in Sri Lanka?
Yeah, definitely. I think that there is some transferability, because I guess one of the core principles is giving respect to diversity. You know, that sometimes when we're working with a community or group of communities, we tend to think that experience looks the same. And, you know, the same with Sri Lanka and the different groups within, is that respect to diversity and not making the assumption that that experience is going to be described in the same way. And, you know, for your counsellors, and I'm sure they do the same way, is that, you know, reflective practice and reflective language is useful.
Thanks, Nell. Look, Vivian, love the work you do at Mind Matters in Victoria. I don't know if a lot of people know what Mind Matters do. Would you like to fill us in? And also, how it empowers young people to be a bit more open to talking about mental health and emotional well-being concerns?
Mind Matters is actually a service that educates teachers. So we try and educate teachers about mental health, and so they can work with the students. It's sort of about prevention and early intervention, and we've heard a lot here about suicide, and what Mind Matters is really on about is about trying to prevent suicide happening. So giving children skills about coping and skills about resilience and skills about asking for help, and seeing help seeking not as a weakness, but seeing help seeking as a strength. You know, strong people know how to ask for help, and that's the message we're trying to get through. But we do it through teachers. We do it through teachers because the teachers know their children the best. As we just heard, you know, there's limited mental health services in Sri Lanka, so trying to work with teachers who work with children is a really effective way of actually being able to manage it. And certainly the federal government in Australia, when Australia has had sort of high suicide rates as well, felt that working through teachers who would work with children was a really effective way, and certainly the research has let us know that.
And what are some of the biggest contributors here in Australia for young people with mental health and emotional concerns?
It's probably very similar, and we don't have the trauma, obviously, that Sri Lanka's had, or the tsunamis. But things like, you know, relationships that go wrong, child abuse, sexual abuse, family violence, all those problems that children face and families face are really big contributors to mental illness. So it's the adversity in life, and I suppose one of the things we try and do is trying to give people skills and ways of actually managing the hard times in life, because we're all going to have hard times. The issue is how we get over them and how we find that courage to keep on going. Yeah.
Thanks, Vivian. Carmel, first of all, I'd just like to thank you for being here, and I think it's a very courageous move for Carmel to come here and share her story of a very close family member committing suicide. Carmel, if you can,
Sure.
would you like to share the story with us?
I'll do my best. I will read from my notes because I think that might be just a bit easier for me. And, you know, it was a little while ago, unfortunately, I witnessed a very close family member who took their own life, and it was extremely distressing, to say the least. you know, life can prepare you for many things, but to see someone you love, I don't want to shock everybody, but hanging themselves is something that stays with you forever. The picture in your mind and the emotional state, it's there forever. Followed by a police inquiry, a coroner's quest. All these things had to be dealt with, and there was many, many other things that had to be dealt with. It was quite overwhelming. There were times when I just thought I couldn't cope, but I had to be strong, and I just had to do the best I could do. I didn't know what to do, I just had to keep going. You know, it's been a life-changing experience, and it's been an ongoing process to get through each day. Some days are better than others, some days are crap, some days are great. You know, fortunately, I have 2 wonderful children who are here with me tonight, and some extraordinary friends who provided me the foundation for my coping mechanism. I love them all very much, and it's small steps to the top of the mountain, and I don't know if I'll ever reach the top, but I do know with continued love and support, I'll keep trying and do my best. That's all I can do. Life is a balance, and finding it can be hard, but I've travelled third world countries and seen many people do it hard every day, and they still manage to smile, so I draw strength from that and keep my special memories very safe in my heart.
Thank you, Carmel. And Carmel, I know you're very passionate about Sri Lanka. You actually was in Sri Lanka recently, and I think you went there especially to visit the CCC house and line. What can you share there with the audience of your experience?
Yeah, well, I've actually had a love affair with Sri Lanka since the early 80s when I adopted my son from Colombo. He's actually in the audience here tonight, Ashley. The country is very, very dear to my heart. I've had several trips to Sri Lanka. However, most recently was to see through my own eyes what CCC was all about. I'd read, watched and spoken about CCC Foundation. But when I arrived, I was just so pleasantly surprised and delighted to see the wonderful work CCC House is doing in providing such a comfortable, safe haven for cancer patients and their families. It's at a very critical time in their lives, and it just reaches out to so many people who, without the CCC Foundation, would be much worse off. I found CCC House was amazing. I spent some time there with the staff, the children and their families, and I gained a very small insight into what CCC House provides for them. Some of the families at the transit house have come from miles away, hundreds of miles away. They've had to care for, leave loved ones behind, the worry of sick children, the financial burdens, and, this must be just so overwhelming for them. I couldn't begin to understand. It was a mind-blowing, I just thought it was mind-blowing, there's all these people, and I don't think one can truly understand the significance and the hard work of everybody at the foundation. The dedication and the commitment of the staff is just absolutely remarkable. I visited also the hospital next door and spoke with doctors, nurses, parents, saw the children, and I just think it's just up there with our Ronald McDonald House here in Melbourne. However, we're here tonight to talk about CCC Line, and that's something that I'm very, very passionate about. Sri Lanka itself I'm passionate about, but I felt that CCC Line, it was like a quiet, sleepier little dwelling. I met the staff and had discussions with them and the call centre staff, and they do such a great job. I wasn't there for very long, and it would have to be an exceptional person to work, to pick up those phones and accept the calls. The counsellors were strong, calm, caring, and this is taking calls for people who are in a delicate state of mind. It would just take so much courage for both the counsellor and the person to make the call. It just wouldn't be easy. I'd like to help raise the profile of CCC Line and take a vested interest in raising more funds. I think mental illness can be described as silent, hidden. It's a dark condition. There can be a dreadful stigma attached to mental illness, and it's easy for one to turn their back on something they don't understand. So I think all of us here tonight, all of us as humanitarians, we must dig deep and raise as much awareness and funds, and I believe together we can all assist the people of Sri Lanka.
Thank you, Carmel. Thank you. Kumar, if I can come back to you, you have travelled the world through your cricketing career, and wherever you go around the world, you're surrounded by Sri Lankans, and Melbourne is no exception. And the Sri Lankan expat community in Melbourne and throughout the world do wonderful work to help the needy in Sri Lanka. If you have to say one thing to the people in Melbourne, as well as on a global scale, about mental health and supporting mental health initiatives, what would you say?
Well, I think Carmen put it perfectly. It's about raising as much awareness as possible and helping Sri Lankans who are in that delicate situation take those small steps towards overcoming the issues that they are dealing with. And I think mental health initiatives in Sri Lanka, like CCC Line, I visited the house and they need funds. They need funds to train their counsellors. They need funds to have more counsellors available. They need financing to have more phone lines available. They need financing to keep those phone lines open for longer. And they need finances to spread the word, raise awareness, and tell people and media organizations how better and more responsibly that they can deal with mental health issues. So we have a lot of Sri Lankans in the audience, we have a lot of Australians in the audience. And Sri Lankans are known around the world to be happy-go-lucky people with a sunny disposition, always smiling. But not everything is that obvious. Sometimes those smiles can hide something that is dark, that is slowly eating away at what was put before as the fabric of society. And mental health issues in Sri Lanka, children are the most vulnerable at this point in time. So if our responsibility is towards ourselves, then I think we owe it to ourselves to really get behind initiatives like CCC Line and ensure that we give of ourselves, our time, our finances to these initiatives. So if we can find it in ourselves to do just that, I think we would have taken a great step forward in a small way, but surely towards dealing with these problems more effectively.
Thanks, Kumar. Ladies and gentlemen, could you please join me in thanking the whole panel here. Thanks.